Welcome back to Twin Cities Live. So May is Mental Health Awareness Month. You know, mental health disorders can impact people starting at a very young age. Well, fortunately, there are resources here to help right here in Minnesota.
Boy, we have one of the best resources in the country. As we thrive with Twin Cities Live, we are sitting down with Rannon Arch and Dr. Jennifer Exo from the Hazelden Betty Ford Foundation. Welcome.
Hello.
It's so nice to
Thanks
have
for being
you here.
Thank you.
This is a big topic. And Rannon, let's start with you. Let's talk about kind of just in general, remind everybody, because you know, maybe if you don't know somebody who's been to Hazelden and spent time there, you're not as familiar with how important it is, the work that you're doing.
Yeah. So, of course, we are Hazelden Betty Ford Foundation. We treat substance use and mental health conditions and have been doing so for 76 years. We were founded right here in Minnesota, up in a small farmhouse in Center City, and have since expanded to 15 different locations across the country, where we do family services as well as children's services as well.
Listen, I know it can be really hard when people go, but the amount of people that I've met who've been like, I came to Minnesota to go to Hazelden, and I fell in love with it, and I never left.
I know, people love it, and they get out and they just want to stay here.
They fall in love with Minnesota.
Yeah.
I mean, I bet you didn't really anticipate that happening.
No, but we have a huge thriving recovery community as a result of that.
That's amazing.
Yeah, that's so true. I guess they have a kind of a tight-knit group of people even when they get out.
Yeah.
So, okay, so Dr. Exo, I want to ask you this because I think typically, and maybe this is just my fault, I don't think of like youth and teenagers needing your guys' services. I always just think adults, right? But so how prevalent is some of these conditions with our young adults?
Well, it's a great question. And what I would say is that youth are in the midst of a mental health crisis.
Yeah.
And that's true across the country. It's true here at home in Minnesota. And nearly a third of Minnesota students are struggling with long-term mental health issues such as depression and anxiety. And that number's actually increased about 25% since 2019.
Big pandemic issue.
Big pandemic, and even predating the pandemic, but definitely made worse by that.
Okay.
And I think the other thing to know is that there seems to be gender differences. So girls are more likely, almost twice as likely to report having mental health issues compared with their male student counterparts.
Wow. Oh, is that, do we know like exactly what it is? Is it social media, you know?
That's a great question. I don't know that anyone's teased that out, but I think it's important to be aware of it because it helps us tailor our support, our treatment to those particular youth.
Interesting. So I think it's important to note, you know, that if you feel like you want to help, I mean, where do you even go? And I think that can be so overwhelming for families if they had a child. Like we have some friends who had a child who was really struggling, and it was like just trying to figure out what to do. So what are you guys offering, Rannon, that can kind of help people at least have, here's a starting point, and we can see if this might be right for our family?
Yeah, well, we've seen such a rise in mental health in these last 5 years that we actually started developing new programming as a result of it. We're now including mental health much more robustly in our services, where patients are getting real-world mental health skill work. We're doing much more integration with patients to help them understand the connection between mental health and substance use, as well as increased access to our psychiatric and individual services. It's really trying to provide more wraparound, holistic mental health for our folks.
Okay, because do they go hand in hand so much because people have mental health and then they're sort of trying to self-medicate with substance? Is that the core, really?
That's usually the core. Sometimes it can also be the inverse, where somebody's using substances and it actually exacerbates or worsens their underlying mental health symptoms.
Got it.
I mean, this has to be certainly a case-by-case basis because everybody's story, it probably has, the root cause of it can be so unique and so different, and then how they treat themselves can be so unique and different as well. It's very challenging.
Yeah, everybody's story is completely different.
Okay, so docs, how do families, like, how do they deal with this? You have the patient that goes in, you get to that point, and then how is the support staff at home? The grandparents, the guardians, the siblings, like how can they help sort of send the same message and be supportive as well?
Yeah, well, you know, we know that mental health issues and substance use issues aren't always just about the patient who's going through them. It also affects the family and the people that care about them. So kind of the first thing I think about when I'm educating or counseling families is, and this would be true for a family of a teenager, whether they're dealing with mental health or substance issues, period, would be to start having open, non-judgmental conversations with their teens about mental health issues and substance use, right? And what we're wanting is to help that teen feel supported, to feel understood, and it's also a great time to talk about family expectations around substance use and set boundaries around not using drugs and alcohol.
Okay.
Yeah. I'm guessing there's probably for the patient some shame involved, so any sort of negativity is going to make them feel maybe worse about themselves. So like, there probably is an elephant in the room, but as a parent and then as a guardian, be like, okay, we just need to be here to love on you and not make you feel shame, right?
Yes. Yeah, I think that's actually a huge part. And with that, not only wanting your teen to, you don't want them to feel ashamed, but also as a family member, a lot of times parents will take that on and feel like, okay, well, this is happening because I did something wrong.
Yeah.
And what we want people to know is that that is not at all what it's about. Nobody did anything wrong, but there are ways that we can help both the teen and the family recover and thrive.
So does it become then, okay, we're treating the patient, but then the family is there to be able to learn how to support that person and try to move forward?
Yes.
Yeah.
Yeah, I think that's actually a huge part. So, what we would want is to help educate families about mental health and substance use disorders and their treatment. So you could start simply just by talking with your kid's mental health or medical provider. Our website, the Hazelden Betty Ford website, has specific parent resources, a number to call if you need help.
That's great.
And then the American Academy of Pediatrics, the Substance Abuse and Mental Health Services Administration, 2 other great organizations that have reliable educational content and parent resources.
Yeah, well, this is so helpful, you guys. And I know, ideally you'd be in a world where you didn't have to offer these services, right? But boy, are we grateful that you're here. And this was really helpful to just give people a starting point and to just know you're not alone and that there is help out there.
Yeah, thanks
so much.
guys.
Come see us again, okay? So Hazelden Betty Ford Foundation is the nation's oldest and largest nonprofit organization dedicated to addiction and mental health treatment and recovery. And again, they're located in 8 states. They offer services for kids as young as 12 and adults of all ages, and they lead to a lot of people falling in love with the great state of Minnesota.
Yeah,
I think they need to put that on their marketing material.
Yeah, it just increases our population.
Yes,
It's great.
It's lovely. Welcome.
So to learn more about the various treatment plans, head over to their website. You saw it just a second ago, herewithyou.org. We also have a link posted on TwinCitiesLive.com. We'll be right back after this.